Welcome, my loves, to another episode of Beauty Unlocked. I'm Carissa, and today we're diving deep, literally, into one of the latest cosmetic procedures that's been making waves in the world of intimate aesthetics. You read the title right. Why are women getting their labia puffed? Yes, you heard that correctly. It's called the labia puff, and while the name alone might have you raising an eyebrow, this procedure is becoming more and more common. So buckle up, my loves, because we're about to explore the who, what, why, and how behind this controversial trend. Are you ready? Now, before anyone starts clutching their pearls, let's make one thing clear. This episode is a judgment free zone. You never really know what's going on between people's legs, both literally and figuratively. So let's leave the judgment at the door. Instead, we're here to understand. Because whether you're intrigued, horrified, or simply curious, the labia puff is a procedure that's gaining traction, and it's time we talked about it. So, what exactly is a labia puff? The name itself might sound like some kind of whimsical dessert, or a cheeky spa treatment, or something you do behind closed doors. Hint, hint, wink, wink. But alas, it's none of those things. The labia puff, more accurately referred to as the labia majora puff, is a cosmetic procedure designed to plump and smooth the outer labia, known as the labia majora. And here's the kicker: it's often done using the same cosmetic fillers you'd inject into your face. Yes, hyaluronic acid fillers like Juvederm or Restylane, or via fat transfer from another part of the body. While the term labia puff has only become more widely recognized in the last decade, doctors have been treating labia majora atrophy with fillers since at least 2010. Board certified urologist Dr. Fenwa Milhouse says she first started hearing the term about 10 years ago, and its popularity has been growing every year since. In fact, Dr. Milhouse predicts that one day the labia puff could become as commonplace as breast implants. Now, some of you might be thinking, why would anyone want a fuller labia majora? But for others, the answer is obvious. The truth is, vulvas change. The external female genitalia, which includes both the labia minora, the smaller hairless inner lips, and the labia majora, the larger outer lips covered with skin and hair, is in a constant state of flux. Puberty, childbirth, hormonal shifts, aging, you name it, all play a role in reshaping the landscape of the vulva. Estrogen depletion, in particular, has a significant impact on the appearance of the labia majora. As we age, typically around perimenopause or menopause, our estrogen levels drop, causing a decrease in collagen, elastin, and fat in the skin. The result? Sagging, deflation, and a loss of plumpness, much like what happens to the skin on our faces. Dr. Mona Gahara, a board certified dermatologist, says that many of her patients who inquire about labia treatments are over 45, with some well into their 60s. But don't be mistaken, this isn't just a procedure for older women. Dr. Milhouse has seen women in their 20s requesting the labia puff simply because they feel their labia majora are naturally too small or underwhelming. One woman, Melissa, a pseudonym, shared her story. At 36, after giving birth, she noticed that her inner labia had become longer and thicker, while her outer labia had deflated. For her, the labia puff was about restoring volume and feeling sexy again. Another woman, Anna, 42, experienced similar changes due to medication induced estrogen depletion. She compared her vulva to a worn out gym sock. Her words, not mine, and said that the labia majora seemed to play a crucial role in holding the inner labia in place. But what exactly does the procedure involve? Unlike labiaplasty, surgery that alters the size or shape of the labia minora, the labia puff is a non surgical treatment designed purely for aesthetics. The most common method involves injecting hyaluronic acid fillers into the labia majora. The procedure takes about 30 minutes, requires only a topical numbing cream, and typically involves 1 to 6 syringes of filler, depending on the desired result. Dr. Milhouse explains that most women want volume, but not to the point of a huge camel toe. The average cost of the procedure ranges from $2,500 to $5,000, with results lasting about a year, although some recent studies suggest fillers can linger in the body for much longer. For those seeking longer-lasting results, fat transfer is another option. This two-step procedure involves liposuction to extract fat from areas like the stomach or thighs, which is then purified and injected into the labia majora. The price tag? Around $5,000 or more, but the results can last up to 10 years. However, fat transfer is far less predictable than fillers, as only a portion of the transferred fat survives long-term. Cosmetic injection Renuva, derived from purified fat cells, is yet another option. It stimulates the body to produce its own fat, offering gradual, long-lasting volume enhancement over several months. But let's not forget, like any cosmetic procedure, the labia puff isn't without risks. Bruising, swelling, lumps, and asymmetry are all potential side effects. And while fillers can be dissolved with an enzyme if things go wrong, fat transfer is far more difficult to reverse. One of the most serious risks is vascular occlusion, when filler accidentally blocks a blood vessel, potentially leading to tissue death. This is why choosing the right practitioner is crucial. Dr. Milhouse advises seeking out doctors trained in urology, gynecology, or plastic surgery, professionals who know the anatomy inside and out. And whatever you do, my friends, I repeat, whatever you do not try this at home. Believe it or not, some women have been DIYing their own labia puffs with black market fillers ordered online. To say that's a bad idea would be the understatement of the century. So, why is this procedure becoming more popular? One theory is that with the rise of full pubic hair removal, women are simply seeing their vulvas more often. According to a 2016 survey, 84% of American women groom their pubic hair regularly, and 62% have removed it entirely at some point. When you're staring at your vulva in the mirror, you're bound to notice every wrinkle, fold, and deflation. I don't know if, I'm not sure, I don't think I tried to erase this, but I moved my wrist and it cracked so loudly that the mic actually picked it up. We're falling apart here behind the scenes at Beauty Unlocked. Back to the show. Another driving force, porn. In adult films and images, the ideal vulva is often portrayed as small, smooth, and tucked in, an aesthetic that's far from the reality for most women. Dr. Milhouse admits that while she loves that women are becoming more in tune with their bodies, this hyper-awareness can quickly spiral into self-criticism. But here's the thing. Is wanting a labia puff really all that different from wanting lip filler, Botox, or breast implants? Whether it's gray hair, wrinkles, or sagging labia, every aesthetic choice we make is influenced by societal beauty standards. And if puffed up labia gives someone the confidence to enjoy their body more, who are we to judge? Dr. Milhouse recalls one patient who told her that after getting the procedure, she felt turned on just looking at herself. Now, how many people can say that about their Botox or lip fillers? At the end of the day, the labia puff, like any cosmetic enhancement, is a deeply personal decision. Whether you're for it, against it, or somewhere in between, the most important thing is to make informed choices about your own body, without shame, without stigma, and without judgment. And that's it for this episode of Beauty Unlocked. What are your thoughts on the labia puff? Would you consider getting one, or is this one beauty trend you're happy to leave behind? Remember, my lovelies, your body, your choice. If you enjoyed this episode, don't forget to rate, review, and subscribe wherever you get your podcasts. Until next time, my love buckets, stay hydrated and stay safe. Bye.
Make it clap, clap, clap. 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 Make it clap, clap, clap.